Good afternoon. My name is Mary Ann Johnson. I'm from the University of Georgia and will be facilitating this session. So thank you, everyone, for being here. So we'll almost have a one-on-one with our speakers this afternoon. And Dr. Stannis is going to need to leave a little bit early, so think about what your questions are for her. Her area was the contribution of parks for physical activity. And this is session 7, environmental influences on weight status and weight-related behaviors. And before I have each of our speakers introduce themselves, I just want to remind you, when you ask a question, if you could identify yourself and your university. So again, thank you all for being here. So if you just want to say briefly who you are and your university.
Okay, I'm David Schlunt. Was trained as a clinical psychologist. I really consider myself a health psychologist. I'm at Vanderbilt University, where I'm in the College of Arts and Sciences, but also work with the Diabetes Center and the Cancer Center there.
All right, I'm Sonia Wilhelm-Stannis. I'm at the University of Missouri, and I'm in the Department of Parks, Recreation, and Tourism, and my area is focused on the role of parks for public health.
And I'm Gene Fitzhugh from the University of Tennessee. I'm a physical activity epidemiologist.
We'll go ahead and open it up to any questions and maybe start with Dr. Stannis first.
Well, maybe just a general question. So similar to, I think, Patricia Sharp, you were able to study sort of a natural experiment. I'm sorry. And I'm just curious, like, I know how she learned of that one, but how did you kind of learn of this coming around? And that's sort of an important question, because I think for environmental research, that's really a key opportunity, but we have to learn about these things before it's too late to
Right,
evaluate.
absolutely, and that's always the challenge, right? It was actually someone who was involved in some of the planning from a local agency or local advocacy group that alerted us that it was happening and wanted to see the impact changes. PedNet Coalition, they've done a lot of work in our area. They were the ones that kind of brought it to our attention and ended up being a partner with us as well. But that's often such a challenge, you know. So often, I drive by parks and I see that they just did something. I'm like, oh my gosh, I wanted to evaluate that. So that's always hard.
And we conducted a natural experiment a few years ago on a greenway, and it was just someone in city government telling us, okay, in 2 years we're going to be doing this. So we had the opportunity to try and find money to go in and fund a pilot study. But it just...
Well, I wanted to ask, what do you think the time frame is that we should be looking at when we do these changes in the built environment and understand how it's going to impact people's behavior?
The time frame for the research?
Well, the time frame for the research, and really realistically, the time frame for populations to adapt to a changed environment.
Yeah, that's a great question. First of all, I guess there's a number of things I want to say. In terms of funding for this, we pulled together just a few things quickly so that we could do the pre-data collection, because we actually didn't have funding for that. We did get funding to do the post-data collection. And then we are currently working on, we did a third year of data collection, trying to see those long-term impacts so that it's not just, did someone respond to an intervention and then, did they go back to their previous behaviors or whatnot. So I do think, if that's what you're getting at, that it's important to get more of those continued behaviors to see the impact longer term.
And yeah, I think a park, when it comes to a neighborhood, is really part of the cultural context of that neighborhood too. And I would suspect when you change a park, it takes people some time to begin to reconceptualize what that resource is and how they're going to use it.
And in the case of the Douglas Park area, it's another reason that we're wanting to do long-term investigations with this is that there's a whole interesting side of this, that the neighborhood was actually really upset about this happening. So initially they were really resistant of, here the commentary was the city's going in, making changes to our neighborhood again. We weren't involved on this. Now that it's happening, they're really embracing and excited about it and want to see more changes. But I think there is this whole context thing and how are they responding to it, and that's certainly part of the equation.
And do you have gentrification going in that area too?
No, actually, not there right now.
Yeah, because we see that in Nashville and a lot of the inner city neighborhoods that the city comes in and does some infrastructure changes. They're working more on the complete streets concepts rather than the parks, and then very quickly on that, the developers are coming in and buying up the vacant lots and putting up high-end condos, and then all of a sudden the restaurants and the bars and the shops are coming in, and you've got a completely different neighborhood than
Right.
you had before.
Yeah, that's not happening right there, although we've seen that in other areas in Columbia. But right now, I mean, and I think when infrastructure changes happen too, it's important to understand the community's perceptions for a number of different reasons. There's some changes that are happening in the park now as well, where they're taking down a structure. It was actually a picnic shelter that visitors were using a lot as kind of congregating. There was a lot of kind of bad behavior going on, like drug use and that kind of stuff. And so the city decided to take down that shelter, and they're going to build smaller shelters to sort of break up that use. The reaction in the community is actually very upset, not for the reasons that you may think, but that shelter had been named after a community member a long time ago that invested a lot into the neighborhood, and they're like, wait, this is symbolic. And so it's so important to understand kind of the interactions of the community with the environment that you're changing or that is being changed, to understand how they're going to react to some of those modifications.
Dr. Stennis, I had another question. You had mentioned you didn't have a lot of time to go over your methodology. So I just had a few questions about how do you survey park usage? Are there national data sets? Or do you feel it's, to do more work at the state and local level? What kind of options do we have?
It's usually collecting primary data, going to the parks. We do on-site surveys where we do on-site intercepts, where we contact visitors. A lot of the studies that I mentioned, also we do observations, and there's some established protocols for that. So Park, So Play, and help me, it's systematic observation of play and recreation in communities. Did I get that right? I always get So Park, what it stands for. There's sort of systematic protocols for the observations as well.
Okay. And what's a good way to, besides, of course, contacting you, but what are some ways we can learn more about, who's doing this kind of research in our own state? Is there a professional organization?
Well, yeah, the National Recreation and Park Association. Okay. I think they're trying to become a better hub for demonstrating some of this data and providing those contacts. Most states have state park and recreation associations as well, and that's a great place to really find out what's going on and get in contact with some of that research too.
Okay. Then I was just curious, from the national level, kind of where are our parks going? Are we headed toward more parks, fewer parks?
Really
different
depends on the
kinds of parks?
community. I mean, a lot of parks and recreation districts have had their budgets just slashed. And so there's not as much funding available right now. But then there's some communities that have invested in it. I mean, that's what some of the talks were just about, and so, even in Columbia, Missouri, we continually keep passing these park taxes where we're investing in parks, and so we see growth in those areas, while there's other communities that have had to shut them down. So.
Does the Professional Association provide any tools for advocacy, or, if you are trying to, make a difference to your parks in your own community?
I think it depends on the particular state and how involved they are in it. I think they're definitely a good resource to find out who are people in the state that could provide those resources. Okay. Whether it's Missouri or whatever, they know what some of the researchers are doing.
Okay. In Nashville, some of our parks have a Friends of the Park not-for-profit association, and then often if you contact one of those that's older and active, they will have a lot of knowledge about how to promote parks and promote park programming.
My name is Judith Wasserman. I'm from from the University of Georgia and the College of Environment and Design in landscape architecture. So it's really interesting to me to hear you all talk, because of course we're the ones that design the parks, and you all are doing research and looking at the benefits of having these systems. And actually, to answer your question, the American Society of Landscape Architects is a really good organization to look for as well in terms of park programs and design of parks and things like that. And so one of the things we're looking at is evidence-based research on the benefit of the work we do as designers
Yeah.
and partnering with folks like you. And
Yeah.
so I'm just wanting to open that up as a discussion item and see how the best way we can facilitate that exchange. I know at Georgia we have a recreation program as well. But if you have any ideas in terms of invigorating that discussion between disciplines, between the folks that are out there designing it, because we have a lot of knowledge in terms of the history of design and the history of the benefits of the park and the long history of doctors prescribing a walk in the park as an antidote to the industrial revolution and the Olmsted Park system. But you all are doing the work now, so how can we partner?
I think that's so critical, and I absolutely agree with you. We just maybe at things like this we need to change our exchange business cards.
Yeah.
But yeah, I mean, I think reaching out, even at our own universities across departments is
Sure.
certainly necessary.
So one of the things, in private practice, and we're training practitioners, not so much necessarily researchers, is that of course you're working on a dollar figure and you're not making a ton of money anyway. So we don't often have that time and that luxury to go in and do the research studies. So it's an exciting opportunity to think about ways to interface with practice and the academy.
Right.
In that
right.
way.
Very good. And I'm really sorry. I actually have to run to catch a flight right now. So thank you all for your interest. And feel free to email me if you have other questions. Or a phone call. I'd love to continue that. So thank you. Thank you.
Hi, I'm Alexandra Pena from the University of Mississippi. I'm actually really interested in food deserts, and I grew up in Washington, D.C., and it's a huge metropolitan city, and we have food deserts there. And in Mississippi, I know we have tons of food deserts there. And I was wondering what your opinion was on how you would eradicate a food desert in a city versus how you would eradicate a food desert in a rural place like Mississippi, where we do have such fertile farmland, and there should be fresh foods and close by.
Well, I think in the rural areas, what one of the things that we've been working on in Tennessee is to work with legislation that's going to enable the government to give a subsidy to grocery store chains for moving into these smaller rural markets. So I see it in some ways as a policy issue, that really it's going to have to be a partnership between people who understand these issues, the public health community, and the government to work together to find ways to get stores to come into these neighborhoods, whether they're urban or rural, and set up a profitable business that's going to thrive. Because if you can't put a store in there that's going to make money, it's not going to be doable. So a lot of it really is coming up with maybe new economic models. We in our communities putting prevention to work in Nashville. We bought coolers and tried to put them into the corner stores in the food deserts so that there were more fruits and vegetables, and we ran into the same issue. The store owners had to see it as a potential way to make more money, or else they were not going to invest the time or the energy into selling fruits and vegetables in the stores. In one of the neighborhoods, Save-A-Lot is one of these mid-level chains in the South, came in and put in a new full-service grocery store, and that's really changed it for the people living in that area. That would not have showed up on the map that I showed you.
I know that for some towns in Mississippi, it's just under 1,000 people or so. So, like you're saying, I'm a public policy major, so a lot of stores don't want to come in because it's such a big risk. So I understand the incentive part. What do you think about having a subsidy given to farmers to plant instead of corn or commodity crops an acre or so of their land for fresh fruits and vegetables that could be sold in the town at a farmer's market instead of a grocery store coming in as an incentive. Do you think that that's too seasonal, or that wouldn't work?
Well, I actually don't think I understand the solution, because one of the things I don't understand is how rural people actually navigate their food environments. So I think that people in these rural communities buy in bulk. They have a lot more, if they're eating fruits and vegetables, they have a lot more canned and frozen items. They have, in addition to the refrigerators, many might have freezers to keep their food in. They supplement it with wild game if they're hunters in the family. So I think that we really need to understand more about, again, these person-environment transactions. How are the people actually feeding themselves, and where in this process can we increase the availability of resources? So perhaps farmers markets on Saturday in the small towns would be the sort of perfect way to get people to buy more fruits and vegetables. I don't know. I'm not sure I understand how people in these rural communities are actually navigating these environments.
I guess some of the towns that I've looked at in Mississippi, they have a central location where either the school or a community center or a church or somewhere that people congregate a lot in the rural area.
Mhm.
So that's what I was
and
thinking.
And if you had invited farmers in on Saturday, would people come and buy their produce?
I would think so.
Yeah.
I would hope so.
Yeah. Yeah, my small town that I live in a town that's just outside of Nashville, and the Saturday farmers market has not been really successful there. I mean, it was great to me because the prices were lower than they were in the downtown farmers market and lower than they were in the grocery stores, but the people just weren't coming to support it.
What I have found through just talking with some rural people is that there's a big stigma, a cultural, I don't know how to describe it, but people who don't normally go to farmers markets, if a farmers market does happen to be eradicated in their town or in their rural community, they're nervous to go. They don't know what to do. They don't know where to go. And that farmers market, for example, might not take WIC things yet, or a SNAP. I know in Mississippi we're trying really hard to have farmers markets accept them, but
Yeah, Tennessee has a website that lists all the farmers markets that take
the
SNAP
programs,
but
yeah.
it wouldn't be all of them by any means. Yeah.
Right.
So the one in Ashland City was not set up to take SNAP. It was a cash
Yeah.
operation, basically out of the back of pickup trucks pulled around in a circle. Yeah.
Very cool.
Related to the, thank you.
Bringing the food to the people idea. A new thing is the buses, having buses loaded with fresh fruits and vegetables and bringing them to communities, bringing them to public housing facilities and things like that. A good friend of mine set up one in Memphis, the Green Machine, out of the University of Memphis. Are you familiar with that?
Yeah, I'm more familiar with the Vanderbilt Mobile Market. That
Yeah.
was the same sort of thing. They essentially had a trailer that they used to bring fresh fruits and vegetables into one of those 4 food deserts that I showed you on the map earlier today, and it's had mixed success. Part of it was, I think, the community perceived these privileged Vanderbilt students coming in and trying to help, and they really didn't perceive that as well. And part of it was just interfacing the arrival and presence of this thing with people's daily schedules and when they're available to come over to the corner and shop and get the food. And then they had a lot of trouble keeping everything fresh as well. So I think it's a really good idea for the urban environments. I think the farmers market model will probably work better in the small towns rather than the mobile market.
In this case, the Green Machine was partnered with local churches, and so they really were, part of the community. They hired folks from the community to work on it, and did a lot of nutritional education, as well as providing the foods as they went through, kind of little videos and things like that about it. So it's a great model if anyone wants to look in terms of urban. You're right, in terms of urban, it would be a little
urban neighborhoods,
unseemly for the rural.
Because again, they're, and we saw that in some of the data this morning, what, 50% of the households did not have a vehicle in some of those urban neighborhoods. So really putting something within walking distance in the neighborhood is very, very important. If you live in rural Mississippi, you would be hard pressed to not have a vehicle.
You would be surprised about how many rural Mississippians
Do not have a vehicle. Yeah, okay.
Do they share? Is there a lot of
I mean, they have some way.
I think there's a lot of community help. I studied the WIC program in Mississippi, and they provide buses because most of their participants don't have a form, because we do distribution centers, so most of their participants in this program don't have any way to get there, so they do public transportation. You'd be surprised by how many rural people don't have phones.
Hi, Andy Kaczynski from the University of South Carolina. I do research on built environment and physical activity, and I've read many of your papers, and thanks for your talks earlier too. They're both excellent. I was just curious, kind of from a big picture, this is a bit of an odd question, but from a big picture research standpoint, the moderator today started out with a comment about this is a very hot topic for NIH and so forth. And I was curious if you would agree with that statement, but more so if you would like share some advice from your perspective on moving this field of built environment and physical activity and nutrition forward, and gaining the respect that more established fields have, or in behavioral health pursuits and things, and your strategies or suggestions around some of that, whether it comes to NIH or other pursuits that we might want to
Let's see,
attempt.
how much can I say without breaking confidentialities? I was just on a study section, and I will say that the built environment, GIS, multi-level modeling was part of a number of the applications. Of course, there's a difference between that and actually being the 5% to get funded. But I don't think there's a institutional barrier to funding this type of research at all. It's just a matter of being able to write just top-notch applications that are going to make it to the winner's circle.
And the notion about the natural experiments, great opportunities happen, but yet to meet that time frame of submitting the proposal, maybe having to resubmit it, it's very frustrating. And I had that experience, and it was, for that year, it was like just praying that we might get hit. But a beautiful natural experiment coming up, but the timing of it and the planning and gaining collaboration, establishing the groundwork is tough. And I think it's just we need more natural experiments, but how are we going to get them funded?
You see some calls for proposals now, like there's a physical activity one out that's encouraging multi-level interventions. And so one of my questions might be, should we continue this, try to establishing and understanding built environment type aspects, or should we go for more of a systems type approach and sort of lose a bit of the emphasis on the built environment, a little bit of the focus on establishing that field, but attack these more complex designs? And do we have a role, a leadership role to play in that, or are we sort of following, or I don't know what the question is, but you know what I mean? Are we, because I feel like groups like Active Living Research and so forth spend a lot of time establishing our field, legitimizing it, and I think we've done a great job with that, but we maybe need to pull back from that a little bit and work with folks across the hall in technology, or people who are doing more psychosocial research and so forth.
I think the multidisciplinary teams is really the way to go. Yeah, so just an exclusive focus on the built environment. And this came up when we were doing our state obesity plan in Tennessee. A great success was all of the metropolitan areas included complete streets in their planning process. So if they're going to go in and change a thoroughfare in Knoxville, Nashville, Chattanooga, Memphis, they're going to give equal weight to bicycles, pedestrians, and public transit. And so as we were talking in the governor's task force, I got a sense that they wanted to see people losing weight and changing their behavior within 6 months of a change like that, and I don't think that's the time. I mean, that's why I was asking earlier about the parks, that I think that we're on a little bit different time frame with altering the built environment. So a policy change in 2012 is actually going to play out over the next 20 years as highway infrastructure gets changed and the cities in the South become a little bit more walkable and bikeable. But how are we going to measure that and evaluate that?
And we keep hearing Nashville is really a great case study, and I
Yeah.
think has a lot of potential for natural experiments, because I believe, didn't your local government allocate like 10% of all their highway funds for a active transport, public transportation infrastructure?
They're trying to get a big public transit infrastructure in place, and all. Of course, the people that live around the right of way are fighting it.
Yeah, I've seen the long-range plan. The potential for those experiments to happen lead me to believe that if I were going to pursue this line of research, I would want to form relationships with the policymakers when the opportunities do arrive in terms of the infrastructure support through policy to create those opportunities for research. But as David, as you said, the policy change today, it's just going to take
I mean, it's
a
going
while.
to play out over years. Well, and I really think we need to be building these cross-discipline relationships. So I do think the landscape architects and the transportation planners and the people that deal with codes and zoning really all need to be talking to the epidemiologists and the behavioral scientists and meeting together and talking about these things and beginning to get an idea of how can we begin to influence policy so that we do create more walkable, more livable cities.
I have a question related to that, and maybe it's a little bit weird in a city conference to ask this, but because we're talking about walkability, we're talking about moving, we're talking about healthy living, but we also heard early on that some of the obesity issues are not having anything to do with that.
That some of it is, genetic and these viruses and, So can we measure it by just the amount of people out and walking as a success versus how much weight people are losing? You know what I mean?
Well, so if you approach it as an evaluator,
Right.
you're going to have a network of measures that go from the sort of the immediate changes that you'd like to see to the downstream consequences. And a good evaluation plan is not going to simply wait 10 years to see if BMI changes. They're going to want to measure the steps along the way. So that's why partnering with people with some of that expertise is a great idea.
Right. And
So that you
just the amount of
understand a
walking.
measurement model and get the sort of short, intermediate, and long-term impacts and try to come up with ways to measure those.
Right.
Yeah. But one of the things I was trying to communicate today is that if somebody tells me I've discovered the cause of obesity and it's gut bacteria, I don't believe them. If they say, I'm working on one more of these lines of causality that are feeding into this perfect storm that we have, then I do think it's really important. So again, I was trying to get us away from one problem, one cause thinking, that it really is a complex situation in this country that's led to this sort of perfect storm where population weights have gone up and diabetes rates have skyrocketed. And I don't think there's a silver bullet or a magic thread that we're going to be able to pull. I think it's going to take multi-level interventions in a considerable period of time to turn a lot of these things around.
But in terms of policy, I think it's problematic that the measure is just, are people losing weight versus, how many people are out walking or how many people are not using their automobile to get to work and things like that, because that it is long range and maybe or maybe not it might be successful, but it's still healthier for people to be walking than not walking.
Yeah, that
You know what I mean?
makes me think of when we got our CTSA grant at Vanderbilt and went to the first meeting, and the biological scientists from the NIH told us that that the community translation people had 9 months to show that you could change population health or you're going to lose all your support for that. What are you talking about?
Right.
You're not going to move population health in 9 months. It's really a long-term process, and I think many aspects to it.
Let me give you an experience in Knoxville. Sometimes counts do matter. we established a set of infrared trail counters across the Greenway system in Knoxville and spent 2 years actually tracking the flow of people over time by season. We then integrated some just very simple trail intercept surveys to find out who's using it, why they're using it. That data and information through the Parks Department, their budget for greenways increased by 25%, and they're continuing to increase because the policymakers are seeing the value of going in and putting in greenways. And it's simply just because they're seeing all of a sudden they're counting, all these people are using these greenways. Wow, we had no idea. And the people who are using them are like this and that. And then they go in and begin to look at what parts of town don't have greenways. So I think some of the simple research by just counting numbers has impacted or has the potential to impact policy on a local level in particular.
Hi there, Sarah Wilcox from the University of South Carolina. And Jean, I really liked the way you laid out a very compelling story. I think it was interesting and, again, compelling. One area that I don't know if you could include data or if you would have data, I was curious about policies related to sort of pedestrian and cyclists and sort of, some states have more serious laws if a pedestrian is hit or a cyclist is hit. And if that is something that you could look at regionally, if you would see the same kind of pattern as you see for, fatalities and some of those markers.
I would think that data may be available. I'm not really aware of it and how you might be able to get it at the level we'd need for all 50 states. But it's certainly something that.
Yeah, I mean, it's really hard to mine some of that. So when we were looking at seatbelt use, we could at least get the state laws for the 50 states. Yeah. But if you have sub-state jurisdictions with different laws, it would be really, really hard to create a data set that's going to reflect that kind of variability for your mixed models. Yeah.
I know there was one state that just their 3 feet law just came into effect last week. I can't remember what state it is, but yeah, I'm sure that data exists, but we'd have to see if it can.
And I have to admit, the thing that got me thinking about this is I was listening to a Freakonomics podcast, and it was entitled "The Perfect Crime," and it was a whole discussion of New York City and how there are not laws, like if you kill someone, you hit someone who's a pedestrian or a cyclist, and how the rates are extremely high in New York City. And it just got me kind of thinking in terms of, perceptions of safety and also just sort of the culture of cycling and walking. So.
Yeah, as a cyclist in Nashville, I started in the late 1980s riding my bike, and I've seen a real change in driver behavior over that time span, so that I do get more distance and I'd get fewer get your off the road than I did 20 years ago. But I've also discovered there's a time of day effect too, that people in the morning are much more polite than they are on their way home from work at the end of the day. So driver behavior's a problem, yes.
So talking about built environment and different things like that, I don't know if you've heard of the active design guidelines that New York is trying to put in place, but I was wondering if you, in your opinion, think that a small change in the architecture of a building, for example, they claim in their book that 2 minutes of active stair climbing a day could help you keep your same weight. Or even reduce it if you do more. Do you think that small changes in buildings, like if policy was created to make these small changes, would that make an effect at all?
I think small changes matter.
I mean, that's the whole public health model, isn't it?
Yeah.
Small changes in large groups of people.
Getting people to take the stairs versus the elevator. I mean, we know that works. Prompts. One of the things that we're looking at in UT is to put prompts at the bus stops. Hey, if you're here and you walk to this building, you'll burn so many calories. Trying to get people to make decisions to walk versus jump on our very user-friendly bus system that goes around campus. So small changes, I think, do matter.
That's actually the area of my research, so I can address it in terms of design and how that can invigorate movement. A good example is Chattanooga, Tennessee, if anyone's been, both are Tennesseans. And I've actually been doing a lot of looking at that particular example on the waterfront because they have a lot that moves one through, and there's a lot of design ways that you can entice people. So it's not just a matter of signage and saying, if you walk here, you know, and that's good, but what's even better is if people don't even realize they're doing it because it's so much fun. So if you have something, you know, a goal, if you see like a cool sculpture or something fun to climb on or cool ways of getting up and down stairs.
Or you got a viewing platform for the river there.
A viewing
yeah.
platform. And so,
Yeah.
you know, there's something always that's, you know, because you can walk around and around that river without even noticing you're walking because, you know, there's always something that's pulling you through or there's a cool bridge to go over. There's a cool little YouTube video. I don't know if you all saw it on somewhere in Europe. They put these, the which? The piano, yes. Yeah, I think it was a VW ad or something. But they, you know, so because people could make music when they climbed, it made them want to do that more. So that's definitely a design solution to all of this that I'm pretty excited about. So yes.
Do you think that those little changes would just make a significant change, or do you think that they shouldn't focus on making those little changes? Like I just feel that if because I'm always thinking about policy. So if the government or some local community said that if you build a new building, you have to, you know, make the stairs visible. Even in this building, I don't even know where the stairs are to get down here.
Yeah.
I know where the elevator is. I know where the escalator is, but I don't know where the stairs are. So just small changes like that. If the policy were to be like, if you make a new building, you are required to make sure the stairs are the first thing you see, or the elevator is, you know, off to the side.
Absolutely. Not only that, but it creates social environments on the stairs so that, you know, the escalators you're going up and down, the elevator you go up and down, but stairs are places where people meet each other, run into each other. It's like the street corner. Mm-hmm. So invigorating community is also another way to get people out and mobilized, because if you see people and it's fun and it's exciting. So absolutely, that's how I see the solution, us designers.
Yeah, I mean, I would love piano stairs somewhere on my campus, so.
I think you see that in neighborhood design too. So we have some historic communities that we're gentrifying, and they put in design guidelines, and they required small setback from the street, front porches big enough for people to sit on, no driveways in the front, so that if you were going to either parked on the street or you did behind. And I think it's created a much more cohesive community there, where people are willing to spend time talking to each other outside and feel safer walking in those neighborhoods. And so I think design really matters.
Thank you.
Yeah.
I do too.
Yeah. But again, it's a 25-year time frame for these things to sort of translate into better population health, because it's accretional design.
But the thing
and
is,
accretional
well,
adaptation.
it's historic too. Like the
Yeah.
front porches, a lot of it is going back to what was historically
Yeah.
there. So it actually, there's evidence based on history versus, you know, necessarily putting it in.
Yeah, they had sleeping porches back then too.
Hi, Brenda Bustillos, Texas A&M University, and I'm still trying to formulate my question in my mind. I work with Dr. Joe Sharkey. We work down in the South Texas border colonias. So if you're not familiar with the colonias in South Texas, the colonias are new immigrant destinations. Many of them have been around for a few decades now, and the population generally is approximately 64% immigrant. Excuse me, that those that are that have papers to be here legally, and others of that percentage are not. And so my concern is that, in though we do nutrition and health disparities research, one thing we do find is a significant factor there that poses many challenges is the built environment. And in colonias, you find individuals who live in a significant portion of rurality. They don't have access or transportation, and even the infrastructure within colonias. You may find many that do not have potable water systems or roads, streets that are conducive to environmental conducive to physical activity, rather. So my question for you is, what do we do in populations such as those who live in the colonias, who may mostly be immigrant populations, in terms of addressing policy? Because I know our policymakers, immigration is quite a hot topic now. And when we pose these questions with our policymakers, and you say that some of the individuals living in these populations aren't even citizens of this country, how do we address helping them and assisting them and individuals who do need our assistance there and who are medically underserved and underrepresented? How do we go about addressing that problem?
Gene, you're running for Senate, aren't you? Go ahead and answer that.
I'm sorry, it's a little long-winded. I apologize.
Well, no, I think it's I think it's a really good question, and I think some of what we have to do is look to developing countries for some of the models as well. So there may be some things that have been done in developing countries that could be transferred into neighborhoods that are that poor and that distressed. How are we going to convince policymakers to have basic human compassion and be concerned about the health of everybody? I don't know how we're going to turn that one around. Steve, you have an answer to that?
Yeah, yes, I do. You ask them because so many of the real far-right ones, they claim to be really fundamentally religious and so forth, Christians. So you say, now you are a Christian, right? So then you say, what would Jesus do?
Yeah, I never seem to win that argument. But no, I think these are really difficult problems. Really more so than if we went to a place like Nashville and Knoxville and look at our poor communities, the infrastructure is so much better there. The possibilities for mass transit and moving people around who don't have cars are there. When you get to a rural, impoverished area like the Texas border there, a much, much bigger problem to solve. And the only thing I wanted to say was sit down with the people who live there and ask them to participate in a planning process to sort of bring forward some recommendations to the different levels of government that are in charge there. That's the only thing that I can think of is
They have a great landscape architecture program, and so that may be a group you may want to partner. Sorry, a group you may want to partner with to do exactly that. Because those are the skills and training that landscape architecture training is all about.
Is that
to
the
help-
charrette?
To help well, not necessarily, but
Yeah.
in whatever kind of participatory process that they're the ones that can take in all that information, work with communities
Sure.
along with you, and then also create the visual realization of and I think that would be
Right.
really a very interesting and important work.
And we have collaborated with them, and there are a few that have done some pilot work that have done excellent in developing community gardens and really assisting with building up the infrastructure in many colonias. But in the state of Texas alone, there are over 1,400 colonias, and they're growing. And so these are small communities to rather large communities, depending on the location. And so it's a larger problem to tackle, even for just one or two pilot projects. And so we're really trying to find out what we could do to make a greater impact. I'm sorry?
Wendy Davis on the way.
Oh.
Jean, I want to pick up on something I thought you might have said, something about making our stairwells more accessible or more interesting to walk in, or maybe it was someone else that brought that
Well,
up.
that's part of the equation, I think, in terms of designing stairwells.
Yeah, I'm just interested in that. We had one of those small grant announcements that came up on campus, and it was integrating health and the visual arts, and two of us had this idea, we should do something, improve our stairwells so people will take them. And then we said, nah, our university would never fund that. But I just wondering if anyone had some experience with that they want to share about,
I know David Bassett at UT has done a small experiment with prompts at stairwells and has shown success in terms of getting people to use stairs. When I teach my EPI class and I talk about prompts, I use the example or case study from the Centers for Disease Control, where they just totally redesigned their stairwells to be attractive, music. It looks like it'd be a pleasure to work and take their stairs. So there are people who are studying along that line.
No, I'm sitting right next to you. I was just saying, one of the things, yeah, no, we're together. We're in the same school. So one of the things in Chattanooga there's so many little elements that do that in Chattanooga. That's why it's fun to study. And one of the things, they have this whole story of the Native American history, but it's like there's little pieces of it along the way, and you have to move to get the whole story. So it's an enticement to move while you're reading, so that's another sort of public art kind of historical informative piece. So it's another way to kind of pull anything that you can think of that will entice and pull through something to read, but you only get bits of it, or the music, that if you do something, it has a reaction, or, just color, just visual color.
I know when there was a Harvard School Public House, they do have those, stairwells decorated and with the pictures and some just like short phrases to encourage you to stay healthy and also, have a, good day. Yeah, at least a decade ago they did that.
Another thing that might be interesting
To look at is some of the work in the subways, because they've done a lot of different like poetry in the subways, or, that could be if it's changing and ever changing and people put up different community art pieces. There's a lot of kind of interesting thing you can brainstorm with.
Oh, I know. So I worked for the architect of the Capitol, and they actually put me on a project associated with the active design guidelines. And I talked to every superintendent on Capitol Hill because they regard it as a campus. And the problem that I came across when discussing with the superintendents how they could possibly put these guidelines to effect, how they could make stairwells better looking, more accessible, they said that the biggest problem they came into was the senators and congressmen just didn't want it. They didn't want... They were in a rush. The staff members that they interviewed were in a rush. They didn't have time to take the stairs. They didn't want to take the stairs. They were older. Some people were older. They didn't want. But I think that, I personally would love to take the stairs if I could find them in this building. But another thing was that what they said was that when stairwells are closed off like that, or when stairwells are just in kind of there's no windows in them, stuff like that. I think that if stairwells did have windows, weren't as sketchy as that stairwell right there, people would want to take it. But I did come into a lot of problems when pitching this idea to people on Capitol Hill, but that's them, so.
Hello, Adriana Coletta, Texas A&M University. I have just to switch gears a little bit, I have a question about what you would propose would be the next step in urban areas or inner cities where the biggest barrier to physical activity and their environment is how unsafe it is. I'm speaking from personal experience from practicing as a registered dietitian. And so you have your obese adolescent, and one of the first recommendations is more exercise, get outside, go for a walk after dinner, for example. But the biggest barrier there was safety in the community, and then the home being not large enough to even think about any indoor activities that could be done to get the heart rate up to burn some extra calories. So I was just wondering what you were thinking, what your thoughts are on the next steps for situations in areas such as, well, I'm thinking particularly of like East Baltimore, for example, those unsafe areas.
I've actually thought a lot about that myself in terms of that is a barrier. We know that, I believe. Through some of the Greenway work, I know that they've identified some of our trail runner sub-surveys, why people didn't use certain greenways, and perceived safety came up as a factor, the city then allocated more police bicycle patrols, greater presence. Now, we don't have the data yet to see if the use increased that way. But at the neighborhood level, you could have a great park with playgrounds, but if the people living near that park do not feel safe, they probably will not use it. It's something I don't have a solution to.
It's a two-level problem because there's a perception of safety issue, and then there's the actual objective safety. And so, a police department can do community-based policing. They can sort of set up. Our police department in Nashville runs its whole operation off of GIS. They know exactly where the calls are coming from and what kind of problems are coming from, and they focus on the neighborhoods where they're having the biggest issues, and they probably have objectively improved the safety of some of these neighborhoods, but they haven't improved the perceived safety of the neighborhoods. So some of that's it's a complicated problem. Yeah.
You might have been part of the study that one of David's students had a solution: stand up and march in place when the commercial comes on television.
Jeremy Steves.
Yeah.
Holly Rayner, sitting in the audience, was.
I just had a quick question to kind of follow up on some of the things about theory. And Dr. Schlent, you talked about theory a lot in your lecture. And I guess I was just curious about moving theory forward in our field. And, and one avenue might be to understand, does the environment have is it a direct stimulus for behavior through, whether it be in stairwells or in parks or wherever, or is the environment's impact on behavior more mediated cognitively, I guess, by perceptions of safety or other things? And I'd be curious on your thoughts on that and or implications for actual interventions. Do they differ depending on the route we think that the behavior actually comes about?
Yes. Well, no, and again, I think these are complex issues, and I can't cookbook a solution off the top of my head. I think community engagement is really part of it, so that if you're dealing with a neighborhood, you want to engage the neighborhood. As our colleague was saying, you don't really want the residents to go, well, you're changing our park again and you didn't talk to us. Yeah, some of it's perceptual, some of it's actual. I really like what Gene's doing with the mining the large data set too, because you're going to have a lot of really cool environment layers there for your multi-level analysis, so that we begin to understand a little bit better about what, at least at the associational level, what predicts differences in walking rates, transportation rates, the individual behaviors. You're linking up to the behavioral risk factor survey too in that?
We're looking at a few different, maybe even in Haynes at some point.
Yeah.
But if I can try to maybe throw something out related to that, a natural experiment we did where a series of neighborhoods had retrofitted a greenway in the middle, going right to an elementary school. So as a part of our evaluation, we did direct observation on physical activity in those neighborhoods, including the controls. We saw that adult physical activity as seen in the neighborhood increased, and as related, we think, to the experimental condition. But the children who walked to school, had direct path through those two neighborhoods, did not change whatsoever. When we went back in, we realized in talking with the schools and parents that it's the perceived safety. I'm still not going to let my child walk to school on a greenway that's got a buffer from traffic. I'm just not going to let them do that because of the safety issues. With a natural experiment, we didn't want to impose anything like that. We just wanted to naturally see if physical activity increased. But if I were working in the community, I would have done a promotional campaign to let people know about the greenway. I would have tried to interact with the parents or to get them to feel that it would be safer, walking school bus maybe to down the Greenway or something along that line. But we didn't try that, but I have a feeling we perceived the perceptions do matter. I mean,
So we did an analysis in Nashville where our hypothesis was that people who lived in neighborhoods that had more sidewalks would be more physically active, and we found the exact opposite of that. And it really had to do with the fact that the sidewalks were in the old inner city neighborhoods, which were poorer, and the better predictor of physical activity was the rating of perceived safety in your neighborhood. So despite the fact that if you lived in North Nashville, there's sidewalks on the streets, you're still afraid to go out. And I don't know if you heard Sherry Barkin talking yesterday. It's not the criminals, it's also the stray dogs that are in these neighborhoods that scare people. Probably in rural Texas, the stray dogs too, yeah.
Well, this has been a really eye-opening
Thank you.
for me, and really enjoyed the questions and the answers, and want to thank you, Dr. Fitzhugh and Dr. Schlunt, for all you gave
Well,
to
and
the
thank you for everybody who
symposium. So
hung
thank
into the
you.
last moment and stayed to talk. Yeah.